Welcome. In today's session, we are going to look at the muscles of the gluteal region. There are usually 9 of them. 3 of them are large, the 3 large and the 6 small muscles of the gluteal region. For each muscle, you should know its origin and insertion, its innervation, action, and we will say something about it, about the clinical relevance. Welcome all. My name is Wallace Munyere and I'm the Daktari. So let's start with the 3 large gluteal muscles. So the 3 large gluteal muscles are known as, they include the Gluteus Maximus, the Gluteus Medius, and the Gluteus Minimus. Now, their origin. The Gluteus Maximus originates from the gluteal surface of the ilium behind the posterior gluteal line. Remember, in the osteology of the pelvic bone, we looked at the gluteal surface, which had 3 lines, a posterior, anterior, and inferior gluteal lines. If you haven't seen the video of that, you should look at it, please. It also originates from the sacrotuberous ligament, also originates from the dorsal surface of sacrum. So that is the origin of Gluteus Maximus. What about its insertion? 3/4 of the muscle fibers usually insert into the iliotibial tract. The iliotibial tract is also known as the iliotibial band. In fact, I think iliotibial band is a more correct term. So let's call it an iliotibial band. So 1/4 of the muscle fibers are inserted into the gluteal tuberosity. So maybe I mentioned something on the iliotibial band. The iliotibial band is the thickening of the deep fascia of the thigh. The deep fascia of the thigh is known as the fascia lata. So the fascia lata is usually thickened laterally to form the iliotibial band, which usually insert into the Gardis tubercle on the tibia. Maybe we'll look at that another time. So, but 3/4 of the muscle fibers of Gluteus Maximus are usually inserted there. Its nerve supply, note, its nerve supply is by the inferior gluteal nerve, please. Inferior gluteal nerve, these are its root values, L5, S1, S2, which are the actions of the muscle itself. So the actions of the muscle is that it is a chief extensor of the hip joint. It is also a chief anti-gravity muscle of the hip during the act of sitting down. So when you are sitting down, you see there is a way you usually stabilize yourself so as not to fall. You don't sit suddenly. So you sit in a certain manner. So that is the action of the Gluteus Maximus. So that is all about the Gluteus Maximus, its origin, insertion, nerve supply, action. Let's do the same for the Gluteus Medius and Minimus. Gluteus Medius, it usually originates from the gluteal surface of ilium between the posterior and the anterior gluteal lines. So between the anterior and posterior gluteal lines, that is where the Gluteus Medius originates from. Where does it insert? On the lateral surface of greater trochanter. What is its nerve supply? The superior gluteal nerve. Its action, it is a hip abductor, not adductor. There is this abductor and there is another term which you will meet, which is known as hip adductor. So should be careful. This is hip abduction. It also prevents the sagging of the pelvis on the unsupported side. So I will show you at the end of this video, of this session, I can show you, I will explain more about this. Gluteus Minimus usually originate from the gluteal surface of ilium between anterior and inferior gluteal lines. It inserts on the anterior surface of greater trochanter. Nerve supply is the same as Gluteus Medius, the superior gluteal line. The superior gluteal nerve. Root values L4, L5, S1. Actions the same as Gluteus Medius. So the action and nerve supply of Gluteus Medius and Minimus are the same. So let's see that on a diagram. Now, This is the gluteal surface of ilium. You can see this is the posterior gluteal line here, and here in blue, this is where the Gluteus Maximus originates from. So on the gluteal surface of ilium behind the posterior gluteal line there, on the dorsal surface of sacrum there, this and on this ligament, which is originated from the sacrum to the ischiotubulosity, the sacrotuberous ligament. Then its muscle fibers, this in blue lines, those are its muscle fibers. They usually slope at an angle of 45 degrees. A quarter of them will insert here, the gluteal tuberosity, and 3/4 will insert into the iliotibial band. Then here in this color, bright red, this is where the Gluteus Medius originates from. So between, this is the posterior gluteal line, and this is the anterior gluteal line here. So between, on the gluteal surface, between the posterior and anterior gluteal lines, that is where Gluteus Medius will originate. Its fibers will run like that to insert here on the lateral surface of greater trochanter. Then Gluteus minimus will originate between, on the gluteal surface of ilium, between the inferior gluteal line there, inferior gluteal line is somewhere there, and the anterior gluteal line. So, and it will insert on the anterior surface of greater trochanter. So anteriorly to this greater trochanter, that is where the Gluteus minimus will originate from. So those are the origin and insertion and insertion of gluteal muscles. So now, please, these images are the ones which now you find in your sport exams. Now this is Gluteus Maximus. You can see its muscle fibers are moving like that. So it is inserted in this. Now this is the iliotibial band. You can see most of these fibers are inserted there. Then just a small portion, a quarter, is the one which is inserted into the gluteal tuberosity. So this is the Gluteus Maximus. Then in this image, we have cut it here, and we have refracted it. So this is the Gluteus Maximus. Yeah, we have cut it and reflected it. Then this is your Gluteus Medius. Deep to the Gluteus Maximus is the Gluteus Medius. In fact, Gluteus Medius is even visible even before we cut and reflect the Gluteus Maximus. Here it is. It is covered by this aponeurosis. This is the gluteal aponeurosis. Covers the Gluteus Medius. It has been exposed. So there it is. Then Gluteus minimus will be now deep to this Gluteus Medius. That is where you find your Gluteus minimus. So let's move on. Now, those were the 3 large gluteal muscles. Now, we have another group of muscles known as the lateral stroke external hip rotators. They are usually 6 in number, and they play an important role in the dynamic hip joint stabilization. When we'll be looking at the hip joint, at its stabilization will be, the stabilizing factors are usually categorized into 2. We have what are static factors and dynamic factors. Dynamic factors include muscles. So these 6 small muscles, the 6 lateral hip rotators, are the dynamic hip joint stabilizers. Then they include these 6 of them. Piriformis, a very important muscle in the gluteal region. Superior gemellus, obturator internus, inferior gemellus, Quadratus Femoris, and obturator externus. Those are the 6 lateral hip rotators. 1, 2, 3, 4, 5, 6. And remember, piriformis is the key muscle of the gluteal region, in that it will provide the key to the arrangement of structures in the gluteal region. So once you identify piriformis in the gluteal region, your work becomes very, very easy. Now, let's look at the origin, insertion, nerve supply. Their action, all of them have one action. Lateral hip rotators, and they are also dynamic hip joint stabilizers. So piriformis, where does it originate? It originates on the pelvic surface of the very middle sacral pieces. As in, it originates from S2, S3, S4. S2, S3, S4. The pelvic surfaces of those sacral pieces. Where does it insert? On the apex of greater trochanter. Its nerve supply, it is usually innervated by the ventral rami of S1 and S2. Superior gemellus or gemellus superior, whatever you can either call it, gemellus superior or superior gemellus, originates from the posterior surface of isthiospine. Where does it insert? It inserts on the medial surface of greater trochanter, along with the tendon of obturator internus and gemellus inferior. So gemellus superior, gemellus inferior, and obturator internus, all of them have a common insertion, which is the medial surface of greater of the greater trochanter. Its nerve supply, remember this, the gemellus superior is innervated by the nerve to obturator internus, which is L4, not L4, L5, S1, S2. If you look at these root values, these are the same root values for the inferior gluteal nerve. I don't know if you have noticed that. So then gemellus inferior originates from the upper part of istiotuberosity and from the lower part of the lesser sciatic notch, innervated by the nerve to quadratus femoris, L4, S1, S2. These root values, if you look at them, are the same like those of superior gluteal nerve. So the nerve to obturator internus, its root values are the same as the inferior gluteal nerve, and the nerve to quadratus femoris, its root values are the same as those of superior gluteal nerve. So obturator internus originates from the pelvic surface of obturator membrane. Innervation, insertion, the same as gemellus superior and gemellus inferior. Nerve, it is innervated by its nerve, the nerve to obturator internus. Root value L5, S1, S2, the same root values as for inferior gluteal nerve. Now, quadratus femoris originates from the lateral border of istiotuberosity, inserts into the quadrate tubercle. If you can remember, along the intertrochanteric crest, we have a tubercle which is known as the quadrate tubercle. That is where quadratus femoris inserts, innervated by its nerve, by its own nerve to quadratus femoris, L5, L4, sorry, L4, S1, I think should be L4. This should be L4, L5, S1. Sorry for that. This should be L4, L5, S1. Don't know why I didn't see this when I was making those notes. Please, please, please. This should be L4, L5, S1. So, sorry for that. So that is the nerve to quadratus femoris. Then obturator externus originates from the anterior surface of obturator membrane, inserts into the trochanteric fossa, and is innervated by the posterior division of obturator nerve. Now let me show you these muscles where they originate from. Can you remember this is Gluteus Maximus, Gluteus Medius, Gluteus Minimus. Now here is superior gemellus, here is inferior gemellus origin. Origin also here is the quadratus femoris. Now this is the trochanteric fossa. What inserts there? Obturator externus. Please remember this. Now on the quadrate tubercle, quadratus femoris muscle inserts there. You can see here is the origin of obturator internus there. Yes, now let's look at insertion of these muscles. You can also see now at this is S2, S3, S4, the pelvic surface, piriformis originates there. It will run through the greater sciatic foramina, we insert here, and the tip of the apex of greater trochanter. Then on the medial surface, this is the medial surface of greater trochanter, just below the insertion of piriformis is where these three muscles will insert: obturator internus, superior and inferior gemellus. Then this is the anterior surface of greater trochanter. Remember that is gluteus minimus. Yeah, those are please, this image, keep it in your mind. Now let's look at these muscles. These are cadaveric images. Remember this is there. This is your gluteus medius. Now this is your piriformis muscle. Once you identify piriformis, your work becomes very easy. Piriformis. Now we have a group of three muscles. This is your superior gemellus. This is your obturator internus. This is your inferior gemellus. Now you can see this muscle here is quadrangular, Quadratus Femoris. Then I want you to see something. The nerve to obturator internus will innervate this muscle which is above it. So nerve to obturator internus will also innervate the superior gemellus. Nerve to Quadratus Femoris will also innervate inferior gemellus. Okay, so this is your Gluteus Maximus has been cut and deflected. The same here, piriformis, superior gemellus, obturator internus, inferior gemellus, Quadratus Femoris. Now your obturator externus is on the other side anteriorly. Maybe do I have an image? Now I don't have an image of obturator externus, but you can look it up. Now let's look at clinical correlation. Now we have something known as the Trendelenburg's sign. Now Trendelenburg sign, remember Gluteus Medius and Minimus, we said they are hip abductors. They when they acting from below, both Gluteus Medius and Minimus prevent the unsupported side of the pelvis from sagging during walking and thus maintain the horizontal level of pelvis, provided the hip joint and the shaft and the neck shaft angle of the femur are normal. When Gluteus Medius and Minimus of one side are paralyzed due to injury of the superior gluteal nerve, the pelvis sags on the healthy side if that foot is off the ground. As a result, the person walks with a lurching gait. This is clinically known as the Trendelenburg's sign. Now, can you look at this guy? These are his lower limbs. Now, this is a normal person. When you lift this leg when walking, this side is unsupported. So the contralateral hip abductors, the Gluteus Minimus and Medius, they contract to prevent sagging on this side. Now imagine, now that side is paralyzed. When you lift this side, the unsupported side, since these are paralyzed, they cannot contract to prevent sagging of the pelvis of this side. So it will sagging of the pelvis on the healthy side. So the side which sags is the healthy side. Okay. So this guy, if he has a the right hip abductors are paralyzed, the left side will sag. Okay. Now I want you to look at this. I want you to look at something here at this guy, and you will see a positive Trendelenburg sign. So can you look? You can see how he's walking. Don't think that is a swagger. You can see this side of the patient is sagging. So it means that the Gluteus Medius and Minimus of the left side are paralyzed. So when he lifts this leg, the right, if the left side, the left hip abductors, they cannot contract to support that side. So the healthy side sags. Maybe continue watching. So that this is a Trendelenburg. So I hope you have seen how it presents clinically. The next time you see a person walking like that, that is not a swagger. They are suffering from the araching gait. So that is the video demonstration of positive Trendelenburg test. So maybe one more. You can see this side is sagging. So this side is the hip abductors of this side are paralyzed. So you can see this side is sagging. See, so the hip abductors of this side, the left, are paralyzed. So thank you. I think I've come to the end of that session, and please subscribe for more content. And yeah, keep reading. And if you have any questions, you can reach out.